I'm Dr. Joe Albano. Let's talk about bioidentical hormones. When we're 20, our hormone levels are up here, 30, they're about here, 40, they really start going down, 50, 60, they just keep going down. This is not optimal. What we want to do is really want to have levels of our hormones of about a 20 to 30-year-old. If we make them higher than that, that's clearly not good too. We don't want them in the range of an ex-governor of California. We don't want them too low either. We want them somewhere right in between. When we check labs, here's the low level, here's the high level. If the level is down here, clearly that's abnormal, and every doctor would agree that replacing it is a good idea. But I'm talking about if our level is right here, if it's not low, but it's not optimal, we bring it up to here. So normal range is not optimal. We want to bring them up to an optimal level. There's a lot of reasons to do this. One reason I recommend this treatment for my patients is to help with healing, and that's how I first got interested in doing this. Another reason is just to have good, healthy benefits from this. And I wasn't taught any of this stuff in medical school. I had to go to several conferences where all we did was sit there for 8 hours a day looking at the medical literature. And the question I asked myself was, does this medical literature really back up this hormone optimization concept? And the short answer is yes, it does. There's many health benefits that we can get from this. We can have cardiovascular benefits, decreasing the risk of heart attack and strokes, musculoskeletal benefits of increasing lean muscle mass, decreasing body fat. We can also get increased libido. My patients ask me about testosterone all the time when I bring this up, and I recommend it for men and women. For women, at woman doses, and one of the benefits you can get is an increased libido, and some of my patients think that's a good thing. One important thing to note is that these are not synthetic hormones, they're bioidentical hormones. They're hormones that are biologically identical to what's in our bodies, what God put in there in the first place, and there's a big difference. So these are bioidentical. Another indication for these bioidentical hormone treatments is in conjunction with our regenerative treatments. For instance, when we're using stem cells to help with a rotator cuff tear, I'll recommend using these hormones to facilitate the healing. If you think of it as a fertilizer, and then the seeds are the stem cells, in conjunction, they both work together to really help with the healing. I've done this myself when I've had various injuries, and it really does work. Professional athletes have used some of these hormones to cheat. Why do they do it? Because it really does work. Now, if you're a competitive athlete, you should check with your governing body to see if it's a legal treatment. For us regular Joes, however, it's not cheating. It's just a really smart and healthy thing to do.